Hi everyone, I'm Scott Taylor. I'm the CEO and co-founder of Perx, and thanks for joining us today for the webinar where we're going to walk through the member experience in the Perx Health programs. At Perx Health, we're very focused on building out digital health programs that actually engage members daily. And you're going to hear us talking about a lot today about daily engagement in digital health. Today, you've got myself, the fantastic Kelsey Kohl, our VP of Sales and Partnerships, who will run through the actual product demo and member experience, and our VP of Marketing, Hadley White, who'll be moderating and helping manage Q&A and making sure that everyone's getting in and out of the webinar as they need to. I mentioned that we're going to talk a lot about daily engagement. It's important to talk about why daily engagement is so important in healthcare, and particularly digital healthcare. And that's because in healthcare generally, we're really good at designing new interventions or new ways of managing a chronic condition or treating an injury. And we're really good at measuring the outcomes, whether that's using patient-reported outcome measures or biomarkers or endpoints in a clinical trial. We're great at designing interventions and testing whether they work. What we really struggle with often is actually making sure that patients are engaging with those interventions, adhering to those interventions, and doing so over an extended period of time. And at Perx, we refer to that as adherent days. So how well are patients sticking to the intervention over a period of time to see the ultimate outcome that we hope for them. Now, given that daily engagement and adherence is so important, the first thing we have here is a bit of a poll and a bit of a question to understand how long does a patient typically engage with the digital health program. Give you a few seconds or a few minutes to kind of put in your responses there. Drum roll, wait for the results. Ooh, quite a few responses and quite a bit of variance, which is great. I mean, I think that is really one of the challenging things, particularly about rolling out a digital health solution, is that you hear a lot about whether a patient will use it, how often they'll use it, how often they'll engage with it. We get some people who are a bit cynical and a bit jaded, maybe looking at 2 days. We've got some people who hope the patients stick with it 30 days. I mean, if we're trying to create long-term behavior change and long-term health outcomes, hopefully we're getting people to at least 30 days, if not longer. But I think it's come a few people who may have seen these slides before and have recognized some of the challenges that exist in digital health, because the reality is, in a meta-analysis of over 100,000 patients using various digital health programs and apps, we do see that the average patient, or the typical patient, is only actually using them for 5.5 days, so less than a week, and actually only completing tasks on 2 of them. And this is pretty representative of the broader challenge we see in engagement, particularly in digital health, that the members who actually need the solution often aren't actually using it. And that represents itself in 4 broad categories where engagement falls down, whether that's low enrollment. We see enrollment rates of 5% as typical. Low daily engagement, so daily engagement rates of 14% is at the average of the top 20 behavioral health apps. That low retention, 5.5 days. And biased engagement. So typically digital health solutions are tested and validated with younger, healthier and wealthier patients, not representative of those we want to roll digital health solutions out to in the real world. So we're here talking a bit about Perx and sharing the Perx Health member experience today. So my next poll question is, how long does the average patient engage with the Perx Health program? Give you a few more seconds to get those answers in. Awesome. Well, the good news is you all think that we do better than the average digital health solution. So we get some saying 5 days. That would be expected, I guess, if that's what the typical digital health solution achieves, 15, 30 days, 100 days. I mean, the good news is that Perx, actually, the average patient on the Perx program, in a Perx program at the moment, is seeing over 200 days of continuous engagement and counting. We have a lot of members who've just joined in the last 6 months, haven't even had the opportunity to get to 200 days, and yet the average across the platform is 200 days. A real step change from what is typical in digital health. And we see that trend continue across all those different categories of engagement that I mentioned before. We see higher enrollment in Perks programs, 50% instead of that 5, 75% daily active users as opposed to that 15% typical. There's 200 days instead of that 5.5. And we've importantly been able to replicate these results with over 30,000 members, and those members who are the highest risk, the older patients, more complex patients, those with low health literacy and more complex social determinants of health, managing multiple chronic conditions. And that high level of engagement translates to a high level of adherence, all those adherent days that I mentioned before. We've been able to demonstrate that if we can engage patients, we can get them to adhere to a wide range of different treatment plans for a wide range of conditions, and a number of different clinical tasks, from medications to physical therapy, logging clinical measurements, attending appointments for conditions as diverse as type 2 diabetes, mental and behavioral health conditions, musculoskeletal injuries. And not surprisingly, when we can engage patients consistently for a long period of time and get them to adhere to their treatment plan, they see better outcomes. And we've been able to validate that in randomized controlled trials and various commercial programs, as well as take those positive health outcomes and improve biomarker control and improve disease outcomes to better commercial outcomes for our customers, where we've seen improved patient member retention, as well as real world cost savings due to patients sticking to their treatment plan, engaging with their treatment plan, seeing better results, and avoiding ending up in hospital unnecessarily. But to give a bit of flavor on exactly how we achieve this, I'm going to pass over to Kelsey Kohl, who's going to take you through the average member experience in the Perx app.
Hey everybody, I'm Kelsey Kohl and excited to walk you through the Perx app experience. So when you log into Perx, you essentially get your daily health to-do list. Perx was built for polychronic individuals to have one single interface where they can manage all of their healthcare. So this can be clinical tasks like taking your medication, having a biomarker measure, or refilling a prescription. But these can also be administrative tasks that a provider or payer may need or want their member to experience and complete at any point in time. This could be interacting with a case manager, reminder to get a flu shot, or taking a survey like a health risk assessment, social determinants of health survey, or even a measure like a PHQ-9 score. The beauty of Perx is really its modularity, that these tasks can be anything and everything that an individual needs to manage their health, and that a payer provider might need their member to do at any point in time to help their health, improve their health. As Scott mentioned, we have over a 90% adherence to any and all of these healthcare tasks. And that's not because this is a simple user interface. The innovation of Perx is not that we have an easy to-do list. It's the behavior and behavioral science behind getting them to do these tasks and getting the individuals to come in every single day, 3 to 4 times a day. And that's because there's different behavioral science levers that we pull in app. Let me walk you through what it actually looks like when we're completing a task. So for a medication task, we'll take a photo. So we can require photo verification every time or some of the time, depending on the person, program, or medication. Once we've verified that we've taken the medication, this is where the behavioral science magic starts to happen. First of all, a gamified experience. We'll have this game, we'll scratch off to see if we have an opportunity to win a reward. Lucky me, I actually won a reward. The thing is, you don't win a reward every time. That randomization of rewards is actually what gets people to come in and complete all of the tasks. If they know that they're going to win a reward every time, they're actually de-incentivized to come in and complete tasks. They know if they just did it later or did it tomorrow, that they'll get that gift card. However, with Perx, they don't know if and when they're going to win. So they're motivated to come in every single day and complete every task because there's that opportunity. I won a reward this time, but I also leveled up and earned Perx points. So these are other intrinsic motivators that get people to come in and complete these tasks. Let me walk you through what that looks like in a little bit more detail. When it comes to your level, An individual, every time they complete a task, earns Perx points. They like to see these points increase and this level increase. That intrinsic motivator that gets people excited to go have that increase over time. But this isn't just a vanity metric. It actually directly correlates with their ability to customize their experience within the app itself. Now, when it comes to rewards, there's a few things that are important to point out. First and foremost, that these are customized on a program basis. So if there are certain types of rewards that you do or do not want to include, say big box stores, for example, those can be not included in the program. Additionally, if there's a dollar amount on a monthly or yearly basis that we need to adhere to, that's also customized on a program basis. Now, on an individual level, this is also customized to make it the most enticing and exciting and personalized experience on a member by member level. First and foremost, you'll see at the top that heart. So that 78 represents perfect days of adherence. So that means I've completed every single task. Every single day I complete all of those tasks, I earn a heart. And I can actually use that heart as currency to customize my reward experience and cater it towards my wants. For example, we have that Starbucks gift card there. I really want my afternoon caffeine fix. So I want the opportunity to win Starbucks cards when I win rewards. So I'm going to go ahead and cash in a few of those adherent days. So now I have the opportunity to win Starbucks cards when I get that reward. Alternatively, people can toggle off different types of rewards. So let's say I don't have a Walmart near me. I'm going to go ahead and lock that so I don't have that opportunity to win. Additionally, I mentioned those levels, that they're not just vanity metrics. You'll see here that these are the rewards available on level 1. But as you continue to increase in your level, you actually unlock different types of rewards. So this is exciting and enticing for people to continue on that journey for the long term. They see that AMC gift card, they want to go see Barbie. So they're going to continue to complete those tasks, earn those points, and increase that level so they have that opportunity to win those rewards. All of those rewards are redeemable here in app and can be accumulated over time, making it a very seamless and easy user experience to redeem at any time. Now, while rewards are very exciting and enticing, it's not why Perx works. In fact, for our long-term users, 30% have actually never cashed in a reward. And that's because there's more exciting and enticing things in app for other individuals. For example, another big intrinsic motivator for individuals is actually their streaks. So you'll see these little hearts on fire. So for every day that an individual completes all of their healthcare tasks, they start their streak. So we have members that have lost their password, and it's not, oh my gosh, I have $30 worth of rewards. It's, I don't want to lose my streak. So this is a powerful intrinsic motivator for individuals to continue to come in and complete those tasks day after day, month after month. Now, while they have those intrinsic motivators and that rewards motivators, we also have individuals that are more social. And that's why we have our community. We have our community here that acts as a really public forum. So individuals can come and share their wins, have camaraderie with other individuals that have similar conditions, and have healthy living tips as well. We had an individual that shared they had a 1,000-day streak. So a polychronic individual that has had 1,000 days of completing every single healthcare task on their treatment plan. Just a really great place for people to find that support and camaraderie. Now, there's other individuals that are motivated socially, but are actually more motivated because they're competitive. And that's why we have our leaderboards. So this is an opportunity for individuals to see how they stack up against the competition. Now, it's important to note that these individuals are matched up with other Perx users that are in a similar place in their journey. So as a person starting out in Perx, they're not going to see that 1,000-day streak power user. They're going to see those individuals that are more in line with where they are. So they can move up or down that leaderboard based on their points and their streaks within the app itself. Now we have all of these different behavioral science levers because we know that there is no silver bullet that works for everybody. So all of these different tools are what we can use for individuals to get excited and come into the app. So that might be the games, that might be the rewards, it might be the community or the streaks, but the way that they're interacting with the app is then how we actually nudge and notify them to come into the app and complete these tasks. So when they do have something due, let's say it's their blood glucose, if someone is constantly checking that streak, making sure that they're not losing it, their notification to come in and take this blood glucose measure would be, don't forget to take your blood glucose, don't lose that streak. Whereas if someone is constantly coming into the community and interacting and posting, may say, your community is waiting for you, take your blood glucose now. And that personalization at scale is why we get those individuals coming in 3 to 4 times a day, every single day, month over month, year after year. What is interesting as well is that those behaviors may change over time. So someone might enjoy the rewards at the start, but then get really motivated by that community. And those notifications and nudges then change appropriately. Now, while we have these tasks here, we can make it very easy for an individual to edit and add tasks at any time. So when it comes to importing their treatment plan at the start, there's a few different ways. We can preload information if we have that certain condition area or medication to make it really easy for individuals during our member onboarding process. But it's also very important for a member to feel empowered as part of this journey. So it's important for them to choose the days and the times when it comes to their treatment plan, taking their medications, measurements, appointments, whatever task that they need to be doing. We want them to make sure it fits into their lifestyle and that they're actually empowered to do those tasks day after day. When it comes to adding a task, it's extremely simple. For example, we can add an activity task by adding a steps goal, add activity. When we go back to that Today tab, you'll see it shows up here as a task. You'll see that daily activity was actually already pre-filled with information, and that's because Perx syncs with Google Health and Apple Health. We also sync with any Bluetooth-enabled device, so a continuous glucose monitor or a scale, making it a very easy and seamless experience for that individual who's managing multiple different types of healthcare tasks. Now, while tasks are the kind of daily or intermittent tasks that we need an individual to complete at any point in time, we also have the Health Hub here, which are more of those evergreen resources that an individual can manage day after day. So this is where they can see their measurements or health insights, how they're adhering to their treatment plans. But this is also where a payer or provider can input that resources that we want a member to manage or be able to access at any time. So for example, if they had a member login or a MyChart login that we want to have here, very easy for the user, or a crisis line or nurse hotline. This can really be anything and everything that an individual can see or access at any point in time. Again, Perx users are coming in 3 to 4 times a day. So there's so many opportunities for us to point them in the direction of information that we need to get in front of them, whether that's here in the Health Hub or with those daily tasks. The last couple pieces here that I like to point out are on the account level. First and foremost, that we're actually able to share health information. So an individual can actually invite someone to get their information in Perx, whether that's a doctor, a family member, or a case manager. They don't need to actually have access to the Perx app, but they can see that individual's health information. This can be really helpful for those individuals that want to share that great information and their health insights with another individual. Additionally, this is where people can contact us for support. They can contact us here or on the Today tab. We also have that message up at the top right-hand corner for Perx user support. So we have our automated FAQs, but we also have live user support to help that individuals with their journey. This can help troubleshoot with the app, or if they need to escalate any type of medical issue up to your teams, they can do so there as well. Here you can see how easy and seamless that Perx is for an end user. And this is why we have 75% of our Perx users coming in every single day, multiple times a day for over 200 days, which ultimately results in those better health outcomes and cost savings for our clients and members. I'm excited to answer any questions that you guys have and walk you through any additional information for the app itself.
Thank you, Kelsey. I love seeing you do that. I always see something new that I haven't seen before, so fantastic. We had a couple of questions. You touched on this, but I wanted to give you opportunity to go into more detail. The question was around whether Perx integrates with any medical devices so you don't have to do manual entry. So yeah, a question around integrations.
Yeah, absolutely. So we do integrate with any Bluetooth enabled device. So a continuous glucose monitor or a scale that can be automatically synced within Perx. We also are connected with Apple Health and Google Health. So if there is any information that is synced there, that is synced automatically back into Perx. So yeah, it can be easily synced with those devices.
One of the things I'd just add there is that, we do find that, we think about adherence problems and engagement problems with medication or doing physical therapy, but we do have adherence and engagement problems exist with devices as well. The number of people running remote patient monitoring programs who sent out a bunch of scales or sent out a bunch of blood pressure monitors and then struggle to see patients using them enough to be able to do things like bill for the RPM code, it is a real problem. One of the nice things about Perx is, as Kelsey is showing in this demo here, when we prompt a user to log a measurement, we can actually positively reinforce the taking of that measurement, not just the setup of that device initially.
Thanks, Scott. For either of you to answer, I had a question whether we've run programs with older populations before.
Absolutely, I can jump in there. So Perx was founded really on the basis of being able to work with any and all populations. So Scott and our other co-founder went to diabetes conferences and we're sitting down with 80-year-olds and saying, what's intuitive, what's not intuitive? And within our target population and our current member base, a large percentage are actually over the age of 65. And within that demographic, we've seen extremely high adherence rates and even longer retention rates. For our over 65 population, our average retention is 495 days of using Perx. So pretty incredible results, even in the older demographic population of our Perx users.
Thanks, Kelsey. So this one is about the crisis line. The question is, how does the crisis line work? Is it rolling to Perx's staff or a company that you're partnered with? And is there any virtual telehealth component?
Great question. So with any nurse hotline or crisis line, that would be on a program by program basis. So Perx is not providing any of the crisis line or user support in that way. This is an example. So if you had a specific nurse hotline or case management hotline or crisis hotline for your particular organization, that's what we would input that number. So that was the type of support we can provide. As an aside, Perx does have user support and kind of can offer health coaching support as additional resources for an individual. But if we were putting in a particular line or phone number, that would be directly correlated with an organization's program itself, not with Perx's program.
The questions are coming thick and fast now, so I'll send you a couple at once. So 2 parts. So what languages is Perx available in? And then who typically pays for the programs? Is it employers?
Great question. So Perx is currently available in English and Spanish. but open to adding additional languages as needed for new programs. And then as far as who typically pays for a program, so usually employers, payers, or health systems. Really the benefit to any of these organizations is that we can provide cost savings through improved health outcomes and decreased utilization. So by getting individuals to come in and stick to their treatment plans, they have those better health outcomes. They are less likely to go into hospital, using less resources, and again, providing cost savings like we've seen over $6,000 in savings per member per year by utilizing Perx. So we do have those different types of organizations that are the paying for Perx on a per engaged member per month basis.
This one is about kind of clinical intervention or help. So is there any work being done to alert the care team or even a family or friend that someone might be at risk, for example, using AI?
Yeah.
Oh, go ahead, Scott.
No, I'm happy to answer that one. I mean, we have, and it depends, as Kelsey said, similarly, it does depend a little bit on program to program. And so we definitely have programs where we work alongside a care management or a case management team. We're actually helping surface those insights to that care manager. But then, as Kelsey also demonstrated, in the app demo, we can also enable patients to share that data with a family member or a carer or a PCP who maybe isn't involved in the initial program. I think in those type of contexts, we can absolutely surface some of those insights, whether it's that they've logged a blood pressure measurement that seems out of control, or they've just completed a PHQ-9 score and alert the care manager that they've recorded that, or just enable them to go over someone's last health risk assessment and see if there's any issues that were identified. And so that absolutely can get surfaced through our care portal. We also have integrations where we can pass that through into an existing system as well.
Awesome, Scott. I think we have time for one more. Do you have an experience working with high-risk populations like Medicaid?
Absolutely. So actually our randomized control trial was within a equivalent to a dual eligible population. So Medicare, Medicaid. So they were high risk polychronic individuals. So low health literacy, low socioeconomic status, utilizing public health resources, and an average age of 60. They had at least average of 2 chronic conditions or more and 6 medications or more. So the highest risk, hardest to reach individuals. And what we found, we actually doubled the odds of treatment adherence, which resulted in positive health outcomes across diabetes and heart and cholesterol. And we also showed that they did that for the long term. So this was over 12 months. So we're able to show that they were utilizing Perx for a long period of time, doubling their odds of a treatment and improving those health outcomes. Both in our randomized control trial, and we also have in our commercial populations, similar Medicaid and underserved populations as well.
And perhaps not surprisingly, with some of the weight that HEDIS scores and or HEDIS measures and star ratings put on things like adherence, medication adherence in high risk chronic disease populations, we've had quite a bit of interest, and we're working with a number of Medicaid plans on how we can deliver Perx to obviously help unlock those cost savings that Kelsey mentioned, that $6,000 per patient per annum that we've seen in some of those high risk programs, but also to actually hit nearer term objectives around adherence in diabetes, behavioral health, and cardiovascular patients where there are specific HEDIS measures and star ratings attributable.
And I think we're out of time. Just want to be respectful of everyone's need to go back to work. Thank you, everyone, for making the time to take half an hour to come see the Perx patient experience. I'll send the recording around later, but if you have any other questions, please do reach out to Kelsey, Scott, or myself by email. We'd love to hear from you. So thank you.
Thank you all.
Thanks, everyone.
Bye.